New at 4, there's a new tool to help people take control of their health. Chronic Obstructive Pulmonary Disease is one of the leading causes of death in the U.S. People with it struggle to breathe. More than 15 million Americans are diagnosed, but doctors think millions more have it and just don't know. But there is a new tool now that shows promise in catching this disease.
Yeah, Karen, thanks very much. Want to talk more about it. Joined now in the studio with Dr. Barry Make with National Jewish Health right here in Denver. Doctor, you are the co-director of the COPD program there, co-authored that study. A serious disease. We talked about the fact that so few people know they have it. Why don't they know?
Well, you know, it's chronic, and anything that's chronic and slowly progressive, you'd say, well, that's normal for me. So if you ask people who smoke if they have a cough, they say no. If you ask, do you have a smoker's cough? Of course I do. I've had it for so long, that's normal. Not normal.
Yeah.
So you have to ask people the right questions before they develop really serious disease. And there's no particular questionnaire that's been validated to do that. And we now have a questionnaire that will do that. 5 questions. If you score 5 or 6, you need to see your doctor right away. You may have COPD. If you score 0 or 1, you're probably okay. If you score 2, 3, or 4, you should see your doctor to have further evaluation about whether you have some lung problem.
Is it usually people maybe in the 50s or 60s, or typically when will people realize or be told that they've got to deal with this issue?
Yes, they usually don't notice the symptoms enough to seek medical care until they're in their 60s.
Okay.
But the disease actually starts much earlier. So people who smoke and are exposed to other environmental influences at work, pollution, secondhand smoke, should get this questionnaire asked of them even in their 40s.
Okay, well, we talked about the new tool called Capture Screening to help patients get a diagnosis. Tell us more about how that works.
Well, it's 5 simple questions. And the questions are not what you would think. It doesn't directly ask about smoking. For example, one of the questions are, have you ever lived or worked in an environment that has smoke or pollution or dust? And that might be an answer.
Right.
One of the other important questions is, have you lost time from work, from school, because you had bronchitis or pneumonia or some respiratory event? That means you're more predisposed to get COPD as well. So these questions are really pretty simple, and I think they should be in all our magazines or our televisions. They should be on graphics like this, so people ask themselves the question before they go to their doctors. Because, when you see your primary care doctor, he's taking care of your diabetes, your high blood pressure, doesn't have time to ask you these questions necessarily, so be vigilant and ask them of yourself.
If people are fortunate enough to at least know and be diagnosed, even though it's a tough thing to learn, but it's good to know, what's the treatment like?
Well, there are a lot of treatments. The most important one is to stop smoking or get out of that environment that caused it to begin with. There's genetic testing, because it could be genetic in some cases. And the treatments largely are inhalers. Inhaled medications help you breathe more easily and be more active. And regular exercise is really important, probably the most important thing. You need to keep moving. Despite the fact that it makes you short of breath, the more you move, the less short of breath you'll be. That's called pulmonary rehabilitation or exercise training.
Yeah. Well, doctor, as we realize with so many medical matters, awareness, finding out is the key, and finding out early. Thank you so much for taking the time, doctor.
You're welcome.
Really appreciate it, as do all of our viewers. And remember, you can find more information about this new screening tool at cbscolorado.com. We'll